So everyone, this webinar is being recorded. Nikki, can you see your record button flashing just to make sure it's being recorded? Can you see?
No.
Okay.
No, I can't.
Just give me a minute. Yeah, it is recording.
Okay, good.
Good morning, everyone, and welcome to the PCAL interview preparation webinar for the new graduate position. My name is Suzanne D'Souza. I'm a PCAL tutor on the Parramatta campus. And with us today is nursing academic, Nikki Meller. Hi, Nikki.
Hi, Suzanne. Hi, everyone.
So welcome, everyone. At this stage, I know you're all very busy getting your applications ready because I believe you will need to apply very soon for your new grad positions. Is that right, Nikki?
It is. It's coming up for New South Wales Health. It starts at the start of July.
Okay, so not long to go now, so you must be really busy. And also a big congratulations to you. You're almost come to the end of your nursing course. Just one more semester to go. Well done, you made it. So lots of things to celebrate, beginning with your application for the new grad position, and I'm sure you're going to be very successful. So at this stage, as I see it, you're getting ready to apply for your new grad positions, after which you will also need to prepare for your interviews. But this is a very exciting time and also a very, very important time because together with you, there would be numerous other applicants. Is that right, Nikki?
Correct. So you think about how many students we have here at Western Sydney. We have probably just on 1,000 third-year students, and all of those students together with all the other universities and their amount of students, they're all vying for new graduate positions. So it's a highly competitive process to apply for a position and then go for an interview. But as majority of you heard at the Grad Expo Day, NAMO said around about 80% of people who apply for a new grad position are successful in gaining one. So it's really important to prepare not only for your online application, but also for your interviews. And this is what we're here to help you do this year.
So thank you, Nikki. I hope everybody heard that. There are going to be thousands of applicants, okay? And you're going to be one among them. So you need to be very well prepared in order to get that coveted position. And that's the purpose of our webinar today, to give you numerous strategies and loads of information so that you maximize your chances of landing the new grad position. Okay, before we actually get into the webinar, I'd like to introduce you to a few webinar tools that you need to be using in order to participate fully in today's webinar. Now, firstly, I've disabled the audio button. What this means is you will be able to see and hear us, but because we have today 109 students, it would be quite chaotic for all of you to speak to us. So you will see us, you will be able to hear us, but you won't actually be able to speak to us. However, we will need you to respond to certain questions that we raise. How are we going to do this? You need to type in your responses in the chat box. So everybody, if you could locate your chat box now, and I'm going to post something. Can you reply to that just to show that you located the chat box? Well done. Okay. Now, the other feature that you need to be aware of is the raise hand button. At various stages of the webinar, we need to check whether, you're understanding, whether you're on the same page as us. So we might ask you to raise your hands to show that you're following, okay? So you did it already. I can see you raising your hands. Well done. Actually, third years are very familiar with the webinar, Nikki. They've been with me doing webinars right from their first year. So they're really good with this. Well done, everyone.
This is excellent. This is something that I'm going to be using in being a professional nurse or midwife unit. I think it's a really great tool to have. It's very interactive, and it's just great to use for, it's easy to access, and for students to actually engage with us as we're live streaming. So it's fantastic.
Yes, it is. And could I also ask everybody, if you have a question, because you can't speak to us, you could post your question on the chat box, okay? At various stages of the webinar, Nikki and I will be monitoring the chat box. So we'll either type in the chat box or we would orally answer the question, okay? So don't need to panic. We will go through the chat box. I know you have numerous questions. Okay, then let's get started. Now, for the first step in putting together your application is to address the selection criteria. So I hope you're looking at the selection criteria very closely and spend a lot of time putting together your application, because you need to give a very good first impression, and that's really important. Nikki, do you want to touch on anything about the selection criteria in particular?
In particular, I just want to make sure that everyone is aware that some of the local area health districts are actually looking very closely at your online applications this year. In previous years, they haven't looked at them as closely in regards to the selection process for interview, but this year, in particular, Blue Mountains Area Health Service, they are looking at your online applications. So just be very thorough when you're answering questions, especially the selection criteria. And on the job readiness site, if you go into the content area of starting your application, there are 3 videos there that will help you in regards to answering selection criteria. So just have a look at those videos. They're not very long, they're less than 10 minutes each. It just gives you some tips and hints in regards to answering selection criteria.
Thank you, Nikki. As Nikki said, during the course of this webinar, she will direct you to those resources, and I hope you use them. Nikki, there is a question here from Jagmeet. She says, I'm going to apply to a Victorian hospital. Will the process be the same or different?
It is slightly different. Jagmeet, can you please send me an email and let me know which hospital you're going to apply for, and I will find out all the details for you and email you back. I'm quite quick on email responses, so if you email me today, I'll find out today for you and let you know. Some Victorian hospitals are a little bit different to us. That's why I need to find out that information for you.
And there's also a query whether this webinar will be recorded and posted on Views. Yes, so you don't have to worry. And one more question, where do we access the online application? Everyone, if you could just hold that question, Nikki will address it shortly, okay? So just bear with us. All right, so as I said, the first step is addressing the selection criteria clearly and putting together a well-articulated application. There are a lot of resources and a lot of help available as well. Now, after that, the next step is to get ready for your interview. Now, that's where many of you fall short because, you know, nerves play a big role. But if you're well prepared, there's no reason for you to feel stressed at all. So a nursing interview is an opportunity for you to display your knowledge of nursing. You will be called for an interview. Like Nikki said, there's an 80% success rate, okay? So for all intents and purposes, you will be called for an interview, which means you've got a foot in the door, so to speak. Use the interview as a platform to display your knowledge of nursing. Outline your previous experience. Discuss your passion for nursing. Show that you're really interested in the job. Stress that you are the perfect candidate for the job. In other words, you need to sell yourself, okay? You need to market your skills. So use the interview, don't get daunted by the interview, but use it as an opportunity to display your skills and your passion for nursing. How do you make employers hire you today? So, be knowledgeable about the hospital, the facilities available, types of patients, their linguistic and cultural backgrounds. Now, how many of you have actually gone onto the hospital website to check out how many beds does this facility offer? What are the linguistic and cultural backgrounds of the patient? What's their mission statement? Can you raise your hands if you've actually looked at the hospital website? Okay, 25, 28 participants. Good. Okay, so a quarter of you seem to have actually done your research. That's really important. You need to know about the organization that you're applying for. So please look through the hospital website, and Nikki and I will show you how to do it. You need to be knowledgeable about the hospital, what facilities, what services do they offer, the types of patients, their linguistic and cultural backgrounds. Also important is to read the hospital's mission statement. Learn about the organization's core values and goals. Okay, so mission statement is what's the purpose or what purpose the organization seeks to address. Core values are the values that the hospital is striving for. And goals are what they intend to do to reach those core values. Okay, so all three are important: the mission statement, core values, and the goals. So be familiar with this job selection criteria, prepare your responses, practice your responses, don't forget, dress appropriately, and above all, be confident. Okay, now I'm going to stop sharing this screen and I'm going to bring up a hospital website just to show you how you can find the mission statement, the core values, and the goals. Okay, so I'll stop screen share and bring up the next one. Nikki, can you see that as yet? Okay.
Sorry, I was on mute.
Yes. So you can see the thing that says Health Western Sydney Local Health District. Nikki, can you see that? The display? Okay. Okay, everyone. I've just brought up this particular hospital website. Say, for example, I'd like to look up the mission statement of Westmead Hospital. So I typed in Westmead Hospital, and it brought up this site. I'm going to click on About Westmead, and just below that, Mission and Values. And there you go. That's the mission statement. We aim for every single patient to receive the best possible care every single time. And we are proudly committed to supporting our vision. That's their mission statement. Do you need to include it in your responses? Yes, you do, to show that you're clearly addressing the mission statement of the organization, and you're also displaying your interest to be part of the organization. The core values are collaboration, openness, respect, and empowerment. If you just know these terms, collaboration, openness, respect, empowerment, and you also need to know the mission statement. It's good to also look up what services do they offer. So let's go back. And I need services. I can't find the one that says services now. I just saw it a little while ago. Okay, let's go to history. The history, it says Westmead Hospital opened in 1978. Services. No. Oh, there you go. So you need to actually play around with the website. Okay, guys, there are a number of navigation panes. You will need to play around to access the information that you're looking for. So spend some time, look through the hospital website. So here it says, services include acute intervention medicine, aged care, neurology, rehabilitation, etc. So it's good for you to know what services are offered so that, you know, you display your knowledge related to those services. Now, some of you also said, like, you know, when I meet you at workshops, you say that you try to look up the hospital website, you type in the name of a particular hospital, and sometimes you're really struggling to find the mission statement, the core organizational values and goals, etc. Nikki, what would be the best way to go about, you know, what would they type in to look up this information?
Great question, Suzanne. Thank you. If you're looking at a particular hospital...
Sorry, Nikki, do you want me to stop screen share so that you'll bring up what
no,
you... Okay.
That's fine. That's fine. Look up the local area health service first of all. So Westmead Hospital is located within Western Sydney Local Health District. So you would look up the health district first, look at that website, and then it will actually state all the hospitals within that local health district. And that's a very easy way to find the hospitals. Instead of putting in Westmead Hospital in a Google search, if you look up the local area health district or service, much easier.
Can you view this screen, Nikki? It says...
Southwest Sydney Local Health District. Yes, if you click on that, Suzanne. The one underneath.
Oh, sorry. So this one,
yes.
Southwestern Sydney, here.
Okay. And then you'll see the third content area across says home, about us, and then hospitals. And you'll be able to go into each of those hospitals and have a look at their websites.
Yep. Thank you, Nikki.
You're welcome.
So please spend some time, everyone, looking at the hospital's mission statement, the core values, and the organizational goals. I'm going to stop sharing this screen now, and I'll come back to my PowerPoint. Nikki, can you view this screen now, the PowerPoint? Okay.
Yes, I can.
Thank you. Okay, let's discuss some possible interview questions. Now, one definite question you would get is, tell me about yourself. They want to know, your interviewers would like to know about the person they're hiring. So begin strongly, touch on your qualifications and experience. Some of the expressions you could use are, I have recently graduated from WSU with a nursing degree. Now that doesn't apply to you, but the second one does. I'm a nursing student completing my final semester of study at WSU. During my course, I completed 10 weeks of clinical placement. Now, I just threw in that number 10 weeks, but make it apply to you, okay? Overall, how many weeks of clinical placement do you do? Could you type in the chat box? Let me see. How many weeks have you done so far? 15? They say 15. Is that right, Nikki? 4 weeks?
I know it in hours.
Yeah.
By the end of it, you should do around about 860 hours. But even just this semester, how many weeks have you done this semester? and again, people will be different because they're maybe slightly out of pattern. I like Tony's answer, still 6 weeks to go. And that's a good answer, because for your last semester, you do your big 6-week block.
Yeah. So it's good to put it down as hours or weeks. Both are acceptable, Nikki?
Yes. Yes.
Thank you. So during my course, I completed X number of weeks or hours of clinical placement, mainly at the intensive care unit at Concord Hospital. So think about your clinical placements. I'm sure they've been wide and varied, okay? But overall, what did you do? Try to put in where you did your clinical placement. So was it aged care? Was it a mix of aged care, emergency, intensive care? Be specific, okay? This experience has taught me how to work quickly and efficiently in a fast-paced environment. I learned the use of new equipment. Now, your interviewers like to hear that you've used equipment. So name some of the equipment that you've used. Can you type in the chat box any equipment that you've learned to use? Nikki, I might get you to check whether the answers are correct. I wouldn't have a clue about that.
I'm frantically trying to respond to everyone, so bear with me, everyone.
Nikki, it says here defibrillator, IV line, ECG suction. So would they be good responses? Bladder scanner?
Absolutely. But also putting it into context as well. So you've not only used these machines, you not only have been exposed to using these machines as a student nurse, but in what context? So how did you use it? And was it in a clinical setting that you used your clinical knowledge? Did you, so if someone, for instance, was having chest pain and you followed the chest pain pathway and you went and you knew you had to do a set of obs and an ECG, and putting it into that context so that they can understand that you're using your clinical knowledge that you've gained as an undergraduate and putting it into practice. They really like looking and listening to those examples.
Thank you, Nikki. So let's get back to the start of this response again. I'm a nursing student completing my final semester of study at WSU. During my course, I completed X number of weeks of clinical placement, mainly at the intensive care unit at Concord Hospital. This experience has taught me how to work quickly and efficiently in a fast-paced environment. I learned the use of new equipment, such as, add the names there. Working with patients from diverse cultures has made me sensitive to the health needs of people from multicultural backgrounds. Overall, my clinical placement experiences have helped strengthen my nursing skills. Now, you could go on and on and on about yourself, but you need to show, you need to indicate through your language that you're winding up what you're saying, okay? So a word like overall, or to sum up, I've got the required skills and the experience for this position. Okay, so that's how you wind up your answer. So that's about, tell me about yourself. The next very important question that you would get is, what made you apply for this position? Now, when we use the word position, it's very specific to the job that you applied for. Okay, so bear in mind the position description. Think of valid reasons for applying for the job. So possible expressions you could use are, my desire to care for sick children motivated me to apply for this job. Or, my previous position as an AIN at a nursing home has equipped me with the skills required for this job. I have the required experience for this post, and then you need to elaborate because I share a good rapport with elderly people. So depending on the context, on the hospital that you're applying for, you could either use, elderly people or sick children or whatever. Now, these are just possible starting expressions, okay? That's not the total response. you need to elaborate on it and include more information. What I'm doing here is giving you a kind of a framework of expressions that you could use to articulate your answer. Are we all right so far, everyone? Raise your hands if everything is okay and you're with us so far. Okay, thank you. Moving on, tell me about your previous work experience. Now, you definitely need to dwell on this question, put together a well thought about response. Respond by providing work experience related to the job advertised. If you have overseas work experience related to the position, draw on it, definitely. You don't have to stick to, the Australian context. If you have significant work experience, nursing work experience, I might add, okay, not hairdressing experience, nursing work experience, and then you could draw on it. Nikki, what do you think about that, Nikki? Could they touch on their overseas nursing work experience?
Definitely, definitely. Everything that you've been exposed to certainly gives you an opportunity to explain what you have done and demonstrate the skills that you have learned. It doesn't matter if it's just here in Australia. If you've had work experience overseas, which I know some of you have, definitely elaborate on it in your interview, okay? It will give you the opportunity just to put your case forward in regards to your experience. Yes.
Thank you, Nikki. So some example expressions are, I worked as a carer for 3 years. In this capacity, I have helped my patients with their activities of daily living. Now, that's not the total response, okay? You need to elaborate on it. I have considerable experience as an AIN in a nursing home. What did you do in that role? I interacted with patients, their families, and other healthcare workers. My duties were showering patients, feeding them, attending to their skincare, and documenting patient information. Or you might need to integrate the mission statement. If you are explicitly asked a question about the mission statement, at the interview, you need to integrate that into your response. Even if you're not asked a question about the mission statement, it would be good to integrate it into your response, in some part of your response. So with regard to the mission statement, here is a good answer. In my previous role as an AIN at the Royal Women's Hospital Randwick, I worked in accordance with the hospital mission statement. The mission of the hospital is to provide women and their babies and families with excellent care in a responsive, collaborative environment. In compliance with this, I worked in partnership with new mothers and their families to provide patient-centered care. So this was what you did in the past. You could also apply the same to the current organization that you applied and touch on their mission statement. So remember, you need to outline the mission statement. So here we have the mission of the hospital is to provide women, their babies, and their families with excellent care in a responsive, collaborative environment. And then you need a word to signal that you're going to link what you do or did with the mission statement. So you need a word or words such as this, in compliance with this. This here meaning the mission statement, or you could say similarly, likewise, in keeping with this mission statement, in accordance with this mission statement, and then elaborate on what you've done. Does that make sense, everyone? Raise your hands if you're all right with that. Okay, good. And the final answer here, being an AIN for 2 years has enabled me to conduct health assessments, discuss dietary requirements with patients, care for open wounds. So please include all the things that you've done, or the main things that you've done in your different roles as, an AIN or whatever nursing position that you worked at. Moving on now. What made you decide on nursing as a career? Now, what's the difference between this question, what made you decide on nursing as a career, And the previous question that we talked about, what made you apply for this position? If you remember, I said, when you get a question like what made you apply for this position, it's very specific to the position that you've applied for. So you need to talk about your skills related to that position. But if they ask you a question like, what made you decide on nursing as a career? That's much more broader. It's just asking you, how did you get interested in nursing? Okay, so it's a much broader question. But avoid responses like, my grandparents were nurses, my parents are nurses too, so I decided to become a nurse. What do you think, Nikki? We avoid that?
Sorry, can you repeat that? Sorry, I'm frantically trying to answer these questions. I didn't quite get it. Sorry.
That's all right. I just put down this response because in one of my workshops, when I asked students, what made you decide on nursing? A student said, my grandparents were nurses, my parents are nurses too, so I decided to become a nurse. What do you think of that response?
Please don't say that. Yes, it's great that it's a professional or career pathway that's in the family, but talk about what attracted you personally to the profession. Why do you personally want to become a nurse? And this has much more credibility to answering that question.
I'll give you another good one, Nikki.
Yeah.
Another student said when I asked the same question, well, I actually wanted to become a doctor, but I didn't get the ATAR, so I decided to use nursing as a pathway. What about that?
Again, it does not look favourable if nursing was a second choice. So you need to really emphasise why you chose to be a nurse, and you need to make sure that you actually believe what you're saying. If you've gone into the profession for other reasons, sometimes it can be conveyed in your interview that you might not be as enthusiastic as others. So really think about that question and try to even just reflect on it now. So what made you decide on a nursing career? Most subjects in the first and second year, as a bit of a icebreaker question when we go into a new subject at the start of a semester, we might ask that question. You know, why did you decide on nursing? I know in PP1 classes we do that every year. I certainly do. And it should have evolved. The reason why you've chosen nursing would have evolved from first year to third year. So even now, if you just jot down a couple of points, couple of sentences in trying to answer that question now, and really think about it so that when you go into your interview, you're prepared for that question. If it comes up, it may not come up, but if it comes up.
Yeah. And definitely avoid the last response. I thought I'd become a nurse because nursing is recognized as a good profession in Australia and there are a lot of nursing jobs. Here it implies that your only thought is to making money, okay? But you need to indicate that for you, nursing is not a job, okay? It is a vocation. Right. So here are some better answers. What made you decide on nursing as a career? I have a natural affinity for looking after people. I always patiently cared for sick people in my family, accompanied them to doctor's appointments, and ensured that they took their medication on time. So nursing was my first career choice. Are you happy with that, Nikki? Are you happy with that response?
That's a much more personal response to that question, yes.
Or the second one, my mother-in-law passed away after a long battle with cancer. I witnessed firsthand the care and support that was provided to her by a team of dedicated nurses. As a result of this, I decided to become a palliative nurse or whatever nurse you want to be and make a difference in the lives of terminally ill people or children. Okay. Before I continue, Everyone, I'd just like to let you know that Nikki has been really busy and is busy answering questions in the chat box. I will save all the responses in the chat box so that you can get back to it and look through it later, okay?
I apologise if I miss any questions. I'm trying to make sure that I answer them as we go.
Can you describe a challenging situation you encountered? Now, this question is quite a challenge for many of you, okay? Here, when we say challenging situation, we mean, did you encounter any negative situations, any problems, okay? But the thing is, you need to describe the problem, you need to describe the challenge, but you also need to say how you dealt with it, how you were able to overcome it, okay? So that will make your answer stronger, not just saying, oh, well, I dealt with difficult patients. How did you do it, okay? So here are some ways that you could do it. Ensure that you focus on a nursing-related situation. Remember, it's a nursing interview, so the situation has to be related to nursing. First of all, introduce the situation. I recall a particular situation that occurred when I was feeding an elderly lady, and then you narrate the situation. I faced a difficult situation when I worked as a carer in a respite center. Or my nursing skills were put to the test when I met an angry family member. Describe the incident. Problem solving is part of a nurse's responsibility. One day when I was, and continue with your description. So first of all, introduce the situation. Then you need to state how you dealt with the situation, okay? That shows your skills as a nurse. I was able to advise the patient that. So when this incident happened, I was able to advise the patient that, or critical thinking was the key to dealing with the situation. I, blah, blah, blah. After consulting with the NUM about the ward protocol, I explained to the patient that, or by involving the patient in his treatment decisions, I was able to, and the final one, I acted in a professional manner by. So these are different ways you overcame the situation, okay? It's just not restricted to this. You might come up with varied and different responses, but this is a start. Think about the situation, introduce the situation, and then explain how you dealt with the situation. Now,
Suzanne, can I just make one point here?
Sure.
I had a question on the chat about not actually having a job as a AIN or in healthcare previously to coming into the nursing degree, and the only experience they have had has been on clinical placements. I had exactly the same situation. I did my undergrads here, and I had no exposure to a hospital environment or working in a hospital environment previous to doing my degree. This does not mean that you can't answer the question in the context of a previous job. So it does not matter. For all the nursing related questions, obviously you would answer them with an answer that was focused on nursing skills and challenges and trying to answer that. But also, don't be afraid to actually try and answer it from previous experience as well. I can see somebody was talking about mature age student. Again, I was a mature age student. Nursing was a afterthought for me in my mid-20s. So I had previous business experience. And when I was asked questions in my new grad interview about leadership and about challenging situations, like Ty, I think, had a chat about, can I give 2 challenging situations? So what I did was I talked about a challenging situation whilst on clinical placement, and then I talked about a challenging situation in a previous workplace. I have specifically asked people in local area health services about students who panic, because I have had students already asking me, I haven't had, previous to the webinar today, about I've had no other experience apart from my undergraduate clinical placements. And that is absolutely fine, as long as you answer the question to the best of your ability, but putting it into context. So what was a challenging situation? Like Suzanne is saying, you introduce the situation and then putting it into context and then how you dealt with it. You are at no disadvantage if you've worked at McDonald's for 5 years and you're doing your Bachelor of Nursing or Bachelor of Midwifery now, and you've only had clinical placement experience. You are at no disadvantage whatsoever, okay? It's about the way in which you respond to these questions in your interviews, and this is what practicing is all about. And this is why Suzanne is raising this issue now, so that we're making you aware of how to start practicing once you've applied, but also the workshops that the careers unit are running, as well as the workshops we'll be running at the start of spring semester. So after you have applied, you'll have plenty of opportunity to practice, and we will be putting up example questions. And I know Suzanne will touch on this a bit later, but we'll be doing lots of practice for you all, so that you can go into these interviews as prepared as possible, okay? But you are at no disadvantage if you have had no previous exposure to a healthcare environment or job.
Thanks.
Sorry, I just had to say my bit.
Important point, very important. Okay, now with this question, how did you deal with a challenging situation? Just don't go into the interview, being focused on the word challenging situation. There are various ways to frame the same question. So they might not ask you, how did you deal with a challenging situation? They might ask you, what are some of the negative aspects that you encountered in your nursing, as a student nurse? Or did you face any problems when you went on clinical placement? Did you have any conflicts with colleagues? Okay, but basically it's the same. They are asking you to talk about some of the challenges or problems that you encountered. So it would be good for you to actually think about this response. Now, this is important. What attributes do you have that would assist you in your clinical practice? Just a minute, everyone. Before we answer this question, can you describe a challenging situation that you encountered? In order to actually put together a well thought of response, can you tell me which nursing assignment that you've done so far that you could go back to and it will actually help you answer this question? Which nursing assignment? Something with PPE? Can you type in the chat box? Which ones? You've done it right from your first year. PPE 1, 2, 3, 4, 5. And every semester for the PPE assignment, you've done something. Anybody? I can't see a response.
Suzanne, they're absolutely PP5 assignments, reflections, everyone's
beautiful, very good, well done. So you see, whatever we do in our nursing course will come in use. So in order to answer this question really well, go back to your PP reflection assignment. In every assignment, you're asked to use the Gibbs cycle. Think about a situation that happened to you. It's mainly negative. If you look back on what you've written, it's mainly negative, and then you talk about how you dealt with it and what you learned from it. It could be even positive, because you could get a question, what positive aspects go with this nursing job or whatever, right? So you could even talk about a positive situation. So take a look at your reflection assignments. I'm pretty sure you would have negative. You could also have some positive. So that's a good starting point, isn't it, Nikki?
Definitely, definitely. Going back and having a look at your reflections, because they're personal about your experiences so far. It's definitely one way of just jogging your memory about challenging situations that you've encountered in the past and what you did about them.
Thanks, Nikki. Okay. What attributes do you have that would assist you in your clinical placement? So they want to know, what are your positive qualities, okay? So another way of framing the question is, what are your positive qualities? Or what do you bring to nursing? What attributes do you have? Please draw on the attributes of a professional nurse. That's a very good thing to do. According to the Nursing and Midwifery Board of Australia, now we are very, very familiar with the NMBA documentation. So, nurses need to be trustworthy, reliable. They need to be empathetic listeners, flexible, optimistic, patient-oriented, an effective communicator, respectful, a critical thinker. Here are some of the attributes. Go through the documentation. I'm pretty sure you're going to come up with more. Now, can you type in the chat box some attributes that you have as related to the NMBA? Here, I'm asking you to think about some key terms like I'm a therapeutic communicator, or I enjoy building a therapeutic relationship with my patients. So can you type in some of those words? You know, those key nursing terms that are so important. I'm an effective problem solver. I can think critically. Team player, advocating for my patients. Are they good ones, Nikki? Sensible to the needs of patient and family.
Yes.
Evidence-based.
Yes.
Critical thinking.
Yes.
Okay, so try to find some of these key terms as outlined in the NMBA documents. Good time management. Yeah. Work within boundaries. You could also say work within professional boundaries. Is that right, Nikki?
Definitely.
Within my code of conduct, work within nursing ethical boundaries. So use the terminology that you've learned. Okay.
Also within your competency as well. You know, as a first year new grad, or you do have to make sure that you practice within the skill set that you know. And with experience, you will learn new skills and you'll become more, less of a novice, and you're on that trajectory to become experts in the field. But just make sure that you're working within your clinical boundaries, and that's in competencies, and that's important.
Yeah. So are we okay so far, everyone? Please raise your hands if you're okay. Okay, good. This is exciting, isn't it? It's a really different and new way to learn. I always say to you, come to PCAL workshops and webinars. We have something good for you to offer. What do you think, Nikki?
It's absolutely fantastic. It's just a really, really good way to engage with you all on this subject. It's very close to my heart. I want to make sure that all of our students are as well prepared as possible for their jobs, their job applications and their interviews, because we want to see you succeed. You have worked very, very hard these last 3 years to get where you're at, and now it's a way in which we can give you the opportunity to help you and to support you whilst you transition from undergraduate to new graduate.
Yep. Okay, we're still working on this response. What attributes do you have? Now, don't just stop with, I am trustworthy. You say that, but then you need to provide an example to illustrate your attribute. For example, I'm an empathetic listener. For example, I always take the time to listen when elderly people talk to me. Add something more to that. Being a team player, I'm able to coordinate care by liaising with the patient's family, and the multidisciplinary team. Effective decision-making is one of my main attributes. At my previous workplace, I usually help the NUM find staffing solutions. My trustworthy nature allows me to maintain patient confidentiality with regard to documentation. So for each attribute that you list, don't just list it. You need to provide an example that actually strengthens what you're saying. All right. What are your weaknesses? Now, we don't like to talk about our weaknesses, do we? But you will be asked about your weaknesses just as you would be asked about your strengths, okay? And I think this is an area where most of us struggle to put together a good response. First of all, what you need to do is try to make your weakness your strength. Okay, so don't always say things like, I'm not punctual, no negative. Try to make your weakness your strength. For example, if I need to consider my weakness, the word is if I need to consider my weakness, okay? It would be that I'm too meticulous with my work, which often consumes time. By meticulous, we mean that I'm a perfectionist. Sometimes being a perfectionist is not good, isn't it? Why? Why being a perfectionist is not good? Of course it's good, but what could be the negatives? Sorry will tell the interviewer. Tell the interviewer what? Time consuming. Yes, Hannah. So if you're a perfectionist, it could be time consuming. Now, don't get me wrong. It's good to strive for perfection, but then it takes time. So do you understand what I mean when I say you need to make your strength your weakness? Okay. So if I need to consider my weakness, so you're telling the interviewer, well, I really don't have any weaknesses, but if I really need to think about my weaknesses, it would be that I'm too meticulous with my work, which often consumes time. Or I always get involved with what's happening with my patients, which makes me feel frustrated at times. Now, nurses need to get involved with what's happening, right? They need to interact. They need to be in touch with what's happening with their patients. What would happen if there is involvement? Cindy says professionalism can lead to disappointment and burnout. Yes, Cindy. It would also apply to this next one, what I said. When you get over-involved with patients, then there could be nurse burnout. Is that right, Nikki?
Correct. You just need to make sure that you, in the first couple of months of your new grad, you will find that it is a very, very steep learning curve. And once everything settles down, managing your time, making sure you know who to ask questions, knowing the way of the ward, how everything works. Once everything settles down a bit, you just need to make sure that you make time to reflect and take time out. It can be very, very hard when you're emotionally invested in your job, and sometimes it's quite difficult to remove yourself from your workplace, especially, for instance, if you've had multiple patient deaths, or if you've had family members that are quite that need quite a lot of support, or if you've got patients that are quite sick, and you just need to make sure that you take time for yourself, your self-care strategies. So when you do go home, if you have families, spend time with families. Just try and make sure that you have some downtime and take care of yourself outside of the workplace, because it is quite a demanding job. And you just need to make sure that once you find your feet, that you put in place strategies. I used to go for walks, and that was my thing. Just 20 minutes, whenever I could, outside, just to make sure I could clear my head, because I used to work in a very fast-paced environment in coronary care. So it was just one way, and that's one thing that I used to do for self-care, is just to make sure that I took time for myself so that I didn't get to that stage of burning out.
Thank you, Nikki. And there's, I think, Fee, who provided this response. She said, I get emotionally sensitive, which is a weakness. But then you could say how I overcame this weakness. So that's really good. Catherine, you have a question. Do you think those answers are too cliched? Well, this is a kind of a starting base. If you're struggling to think about your weaknesses, this gives you a start, okay? But of course, you would come up with better and more original answers. But not wrong to use this as well. One more here. Being too organized sometimes goes against me, as I spend a lot of time, even outside work, planning and preparing my tasks. This eats into my family time. Now, with regard to weaknesses, Nikki, I'm just going to pose this question to you.
Mhm.
Many students ask me, could I say I have inadequate English skills?
No,
I
because
could make that as a strength, isn't it? I could say I am from a second language background, which has given me a better understanding of cultures, right?
yes, you turn it into a positive.
Yes.
It's not a negative, because for your registration, you have met the requirements for English literacy. So it's not a weakness at all. It's actually a strength.
Yeah. So keep that in mind, everyone. What are your career goals? So this is also a possible question. So think about your career goals. Where do you want to be, say, in 3 years or 5 years' time? My long-term objective is to work in a pediatric ward. To this end, I will specialize in pediatric nursing once I complete the new graduate program. Or I like meeting people. Therefore, my career goal is to work as a community nurse where I could make home visits and provide primary health care to families and children in relation to their holistic care. Or if nothing comes to your mind at all, you could use a generalized statement such as this. As a registered nurse, my goal is to adhere to the NMPA guidelines and conduct myself with a high degree of professionalism and integrity. I will engage in continuous professional development in order to learn the most current clinical treatments, procedures, and practices, which would equip me with the skills to provide evidence-based, patient-centered care. Does this give you an idea of how to formulate your responses? Could you raise your hands if you're okay so far? Okay, good.
Can I ask a question, Suzanne?
Sure, Nikki.
Is it still being recorded?
Yes, it is.
Okay, awesome. And I've had somebody asking me that they can't see the chat on the other people's responses. Is that?
Because they have to click on send to everyone.
Okay.
They might just have selected the feature that says send to panelists, so they'll only see what you reply to them.
Okay. So if you make sure that you've got to everyone so you can see everyone's chats.
Yes.
Okay.
Send to everyone. Yeah,
Thank
they
you.
will be able to see it. No worries. Okay, and references. Of course, you don't have to worry about that now. Okay, what we're going to do now is, how many of you have watched The Bold and the Beautiful, the TV show? Hands up. Okay, quite a few people. So what we're going to do now, we're going to have an enactment of The Bold and the Beautiful, but with a twist, okay? I'm going to be the bold interviewer, and Nikki is going to be the beautiful interviewee. Okay? It's going to be a very brief role play. Now, we're not going to role play the whole interview. That would be too much. We're just going to role play a couple of questions. Okay, so here we go. Nervous, Nikki?
I am.
Okay, relax. Let me get my questions ready. Nikki, can you tell me a bit about yourself?
Sure. I have been nursing now for nearly 10 years. I came into nursing as a mature age student. I worked in coronary care for a couple of years. I've moved into palliative care and I went into research as well. I have had clinical experience in those areas and I've been given the opportunity to go into leadership roles within those clinical areas as well. I have also concurrently worked as a research assistant, and for that I did my postgraduate degree. I did a master's in nursing research. I was awarded a Dean's Medal and on the Dean's Merit list. I was a casual tutor for a couple of years and now I'm working as an academic here at Western Sydney.
Very impressive credentials, Nikki. So that kind of positions you as one of the best candidates for the job. But do you feel that you are the best candidate for the job? Do you feel that you are perfect for this role?
I do think I'm perfect for this role.
Right? And sorry.
That's all right. That's all right. What I was going to say, when you answer that question, you need to make sure that you understand what the role is. And for that, if you are applying for your new graduate position, you need to make sure that you understand what the position is, what is expected of you as a registered nurse first year out, and how you can identify yourself with that role. So in answer as honestly as you possibly can. Don't try and go into an interview where you've just repeatedly role-played an answer. You need to go in there and make sure that, yes, you've role-played answers, but be honest with your answers, because honesty is the best policy.
Yep. So, Nikki, how would you contribute to the mission statement and the core values and goals of this organization if I were to employ you?
Sure. The mission of the Western Sydney Local Health District is to aim for every single patient to receive the best hospital care every single time. So in accordance with this, I will focus on delivering quality, patient-centred care by keeping patients at the heart of the care process. I will include patients and their families in care planning, be open with my communication, and be respectful of everyone's needs. By working in a professional manner and within my scope of practice, I will deliver holistic care.
Thank you, Nikki. Folks, what do you think? Does Nikki get the job? If you think Nikki's going to get the job, raise your hands. There you go, Nikki. The job is yours.
Thanks, everyone.
All right, I'm going to stop screen sharing now, and Nikki's got loads of important information. She's got a very, very productive website that she set up, and she will be introducing you to that site now. Over to you, Nikki.
Thanks, Suzanne. Can you see my screen?
Yes.
Can you see the job readiness screen?
Yes, Nikki.
Okay, excellent. So I just want to make sure that everyone is aware and everyone has had a look at the job readiness views site. I developed this site in partnership with the Western Sydney Careers Unit, and I had a lot of help with external stakeholders from local area health services and academics here at the school to make sure that we gave you as much information as possible in regards to your online job applications. Also, when you're going for interviews, also to make sure that you had a one-stop shop with information about facilities, facility information nights, and then workshops that we were running. This is the first time that we've had a site like this available to students. So it's really important that you let me know if there's things that you would like added to this site, to email me, and I'm more than happy to start putting it up. So as you can see, this is the front cover page. This is a timeline. So people would have gone through and had a look at all the different things that were going on through the year. I've tried to minimise my email contact with you all through this site because I understand that you're very time pressured, that you're on clinical placement, you've got exams going on. But I just wanted to make sure that we're communicating to you that there's key dates that are coming up, and to make sure that you all know when these key information sessions, the online applications, when they open, when they close, all sorts of information is there for you. So as you can see down the left-hand side of the content area, I've got all the announcements here, and this is what gets sent to you via email. I've got a what's on page. You might find that that's a bit different. I had a couple of other things on there. We had a bit of a glitch with views, so I'm trying to add different things. When we have workshops coming up, I will advertise them here as well as the careers unit content area. If I click onto there, all you need to do is when you go through here, careers workshops, if you just click on that picture, it will actually come up with the site, okay? And you'll see everything that is available to you through Western Sydney University in regards to your careers workshops. Jackie and Alice work very, very hard within the careers unit. There's also a careers advice hotline that you can call. So I know there was a couple of questions in there, people asking about help with selection criteria and looking at your resume. Give the guys in the careers unit a call, an email, attend a workshop, because they're here to help you as well. And there's a little ding saying I'm on the website. So going to the facility information evenings as well, I've been putting new information up as they come. Not all hospitals or not all local area health services have information nights. I have contacted everybody. I've contacted Western Sydney, Nepean Blue Mountains, Southwestern. I've contacted Sydney, Northern Sydney, and these are the only ones currently that I know of that are having the information nights. Not a lot of people actually do run them. But in saying that, there's nothing stopping you going to the hospital websites that I actually have here, clicking on the hospital site, and it will take you through their website, and that's where you can go and get the information. So as Suzanne was saying before, if you want to go and have a look at a health district in particular, you can actually go onto this public hospital website's content area, scroll through, okay, very easily. You can just click on that and it will take you through to that area or that local health district website, and from there you can have a look at the hospitals that are in there. I've done the same for private facilities, so you can go and have a look at private websites. I've got APRA information here. I will make sure that you all know about APRA registration when you come into the being a professional nurse or midwife unit. Most importantly, at the moment, what I would like you to focus on is the content area of getting organised and then starting your application. These 3 videos here will really help you in regards to some hints and tips when you are applying for your online application. There's nothing stopping you now from doing some drafts, and I know in one of my videos I talk about doing some written work. This is to help you prepare for your job applications, to make sure that you're not rushing and doing it last minute. You can really tell when an application has been thought through, that has been proofread. And as I said before, some area health services or health districts are actually going to look at your application, and if you don't apply well and you don't answer selection criteria correctly, they will be culling people on selection criteria this year. And in particular, that's Blue Mountains. They've specifically said that this year, okay? So this is why it's really important that you try and use all the resources available to you. Now, this is a self-directed website, a views site, sorry. It's totally up to you how much you take in, what you look at, where you go and seek help. If you go to the careers unit, if you ask us for help, it's totally up to you guys. So this is just here so that you have a space, or you have a one particular views site to go to that has all the information that we can possibly gather for you in one place. Is there a show of hands that everyone understands and that everyone has access to the job readiness site? Suzanne, can you see? I can't see. You're on mute. You're on mute, Suzanne. I can't hear you.
Could you please raise your hands if you're clear about how to use the job readiness site, and if you're clear about how to access the information on the site? You can't see anybody raising their hands. Do you have questions about the site? Oh, where can I find it, they say. Where can I find it on Blackboard? So that's the reason. They don't know how to find it.
Okay, so if you can't find it on your Views site, so this is my Views site, it should be here as Nursing Midwifery Job Readiness 2017. If you do not have it on your Views sites, please email me, just a blank email, and just put Job Readiness as the title. Don't put any content, don't say, hi Nikki, I'm not offended. If you email me, I'll get your ID and I will add you to this site. I don't actually know why people aren't on the site. I added all third-year students to the site at the start of semester.
Nikki, I think they just didn't know where to find it. I'm sure they are on the Views thingy.
Okay.
So just follow Nikki's instructions, everyone.
It's on my Views sites, Nursing and Midwifery Job Readiness 2017. You click here, and this is where everything is sitting.
So if you go to your View sites on the left-hand tab, among all the View sites listed, the Job Readiness site will be one of the sites, okay?
Correct.
So you are already enrolled in this site. But Nikki said, if for any reason there is a problem and you are not enrolled and you can't see this View site, please email her.
Correct. Now, the other thing I'd like to make sure that you have had a look at is if you are applying for New South Wales Health, make sure that you have had a look at the 2018 Transition to Professional Practice Handbook. The videos that I did were based on 2017. Now, they're not redundant. The videos still look at all the important features of beginning your online application and getting organised for your job applications. But the 2018 Handbook for New South Wales Health, I really encourage you all to have a read of it if you're applying for New South Wales Health. If you're applying for private facilities as well, you need to make sure that you read and understand what is required of you to apply for those private facilities, additional to New South Wales Health. So make sure that you understand where you're going to apply. You can apply for as many private facilities as you like. So if you want to apply to HealthScope hospitals, if you want to apply to Ramsay, if you want to apply to Hammond Care and New South Wales Health, that is fine. New South Wales Health, make sure you've got your preferences for hospitals organised, that you know which preferences that you're going to put. Then make sure that you understand what is required of you for your private facilities as well. As soon as I know where the main private facilities, when they're opening up their applications, I will add it to the Views site and then make an announcement straight away so that you all know, you will all be emailed to the majority of the privates that will open their online applications.
Nikki, there's a question here from Samantha. She says, if we don't get the full 6 weeks of placement for PPE 6, will that delay our application?
No, it won't delay your application. You apply. You make sure you apply for the jobs now when it's open. It's only open in July, okay? And if I go into here, applications open Monday the 3rd of July and close Friday the 21st of July. You apply, and then if you're offered a interview, you go for your interview. And then if your 6-week placement, if you're placed at the end of semester, that is fine. It will not hinder you starting. If you are successful, it will not hinder you starting your new graduate position next year. Is there any other questions, Suzanne? I can't see the...
There's Nicole, who I think she's a second-year student. She said, will the second years be able to be added to this Views site? This is a pilot study, a pilot site this year. So we only opened it up to third-year students that are currently going through the application process, and this is for nurses and midwives. Second-year students will be added to this site
at the start of next year. So if you're going to roll over to third year, if you're second year student now and rolling to third year, you'll be added to the site next year. And then second year students will be added as of next year, and then the year after that, first year students. We're doing it incrementally, just to make sure that we focus on transition from third year undergrad student to new graduate nurse first, and then we'll open it up to first years and second years after that.
Nikki, you mentioned that if students don't have access to the job readiness site, they need to email you. We have a few students saying, please give me your email address.
I added my email address to the chat way at the start. So I will add my email address again there for you when I've got access to the chat again. This is only for third year students. Kind of stress that at the moment. This is not for second year students. This is for third year students that are applying. I will add you to the job readiness site. Second year students will have access to this at the start of next year. Is there any other questions, Suzanne?
No, not that I can see, no.
Okay. Just make sure that you read your emails. It's really important because that's how we communicate what's coming up. All the workshops that we have coming up at the start of next semester, in particular all the interview workshops that the careers unit are running, and also we are running, so Suzanne and all the PCALS team will be running. We'll be running workshops week 2 and week 3 of spring semester for interview preparation. And it will be run at Hawkesbury, Campbelltown and Parramatta. We'll be giving you those dates at the start of next semester. What I really would like to emphasise is that you concentrate on your applications now. Make sure that you're getting ready for that, that you have your referees done and have been contacted, that you've read the 2018 TPP book for New South Wales Health. You know which hospitals that you're going to apply for, and really focus on the specifics of the online application first. Once you've applied, you come back to spring, we start spring semester, and then we can start doing the interview preparation workshops for you.
There's a question from Hugh. Are those interview workshops specifically tailored for nursing students, or are they general?
No. The PCALS workshops that we will be running will be specifically for nursing interviews. Now, the nursing interviews, there's a few different types of interviews that are being run at the moment. You have your normal panellist interview style, so you'll be there with 2 to 3 other people who are the panellists in that interview. But also Western Sydney Local Health District were trialling the multiple mini interviews last year, and it looks like they're going to go ahead with that again this year. And this is only for Western Sydney Area Health Service, or Health District, sorry. So it's where you go in and you go through it. It's like a cafe style type of interview where you'll be asked a specific question on a table, one-on-one with somebody. You'll be given a certain amount of time to answer that question. Then you'll go to the next table. You'll be asked another question from somebody totally different. And you go around to different tables and you answer different questions at those tables. It was highly successful last year. They even have done a research paper on it, and we'll be going through example nursing specific questions that you may come up in your interviews when we do the interview workshops in spring. Has that answered that question for that person?
I think so, yes.
Good.
There was also some information provided by Tori. She said, hi, Nikki, I've done some research in regards to private hospitals.
Good.
Ramsay, 2nd June to 18th August. And then she has SAN. I don't know what's SAN.
The SAN.
Okay. That's 3rd July to the 21st of July, in case anybody is interested. And then there's one more, MUH. What's that, Nikki? MUH. Yeah.
MUH.
That's from the 19th of June to the 3rd of July.
Excellent, excellent. Thanks, Tori. The SAN is the same dates as New South Wales Health. And Ramsay, I've actually got that up on my screen as well. So ramsayjobs.com.au. This is all of the healthcare facility that Ramsay are responsible for, and you can see there's quite a few there, but these are all around Australia. And then when you go to Grad Plus New South Wales, I'll just click here, and then go to recruitment process and FAQs. It gives you all the information about Ramsay and the Grad Plus program and what the recruitment process is. So what the recruitment process is, the application, the interview, you must bring the following original documents to your interview, notification of offer of employment. Now we will be going through this in quite a lot of detail in the interview preparation workshops. So please don't be alarmed now. It might be information overload for some people. I just can't stress enough that you need to make sure, as Tori has identified, that you need to make sure that you understand when the job applications are open and that you're prepared to put your applications in when the application process is open to specific facilities.
Nikki, Anna said that MUH is Macquarie.
Oh, right, okay. Macquarie University Hospital, yep.
There was a student, was it Anna again? Yes, Anna. You said, are there any workshops that will be specific to midwifery students? Now, Anna, with regard to the interview preparation, it comprises both nursing and midwifery. The preparation is the same. The responses, the way you structure it would be basically the same. However, you would need to touch on your midwifery skills. Is that right, Nikki?
Absolutely. It's just the context.
Yeah.
So yes, definitely. All midwives are included in all the interview preparation workshops. It's just making sure, and I will make sure that there is midwifery specific examples for you as well. I will make sure that we include all our midwifery students and make sure that you have some example questions as well to role play in these workshops.
And Peter asked, what if you have no clinical supervisor referees?
Okay, you have to have had at least one, if not two, clinical supervisors to be a referee. If you can't get at least one, then you'll have to rely on, you can either ask one of your PPE tutors if they're comfortable in giving you a referee report. If not, you just have to go and get a referee from your previous workplace. But I would highly, highly recommend that you need at least one, if not two, clinical referees. Even if you have a clinical placement coming up in the leave break, please try and get one if you can remember a name, a clinical facilitator, anybody, but you should have really tried to have got one in the last placement.
And Nikki, there's a question from Tony. Is citizenship status going to affect the application process?
It does, but it doesn't. What I will do is, I've got some really important information on that. I will set that up on the Views site, and I will show you if I'm still am I still screen sharing?
Yes, you are.
I will put that up on the announcement, and I will also put that up under general international students. Sorry, I'm just in the process of finalising just some other details about visas and things like that. So I will get to that, and I'll put it up on the announcement and on the international students content area for that person.
Jessica observed, I think having a variety of practice questions on this site would be useful. And I think Nikki has a reply to that.
I do. They will be coming up, but not yet. So I've got a content area called interview preparation, and I've specifically held off putting that up yet because at the moment we haven't quite got to the interview. So what you need to do is make sure that your applications are up and you have put in your applications. In the break, I will open up the interview preparation content area, and it will have all this information in it. So example questions, it has a video on interview preparation. We've got examples of panelist interview prep. We've got examples of multiple mini interview preparation. All of this will be given to you. At the moment, it's just information overload, and what we really want you to do is make sure that your applications are successfully in, and then we can then move on to the interview preparation. So yes, you will be given everything.
Could I just add that the responses that I showed you on the PowerPoint was just kind of a teaser to how you need to put together your responses, okay? But I have viewed Nikki's practice questions. She's put together a comprehensive document with, you know, a lot of information with sample questions. You will be very happy with that one. Thank you, Nikki.
Thank you. I'm going to stop share. I'm going to stop the share screen now. Okay.
Sure. Nikki, do you want to speak about any other workshops or anything else?
No, I think I've given all the students the heads up that they're coming for the interview prep. I think everyone understands that it's really important that you look at the Transition to Professional Practice Handbook for New South Wales Health, that you engage with the private facility websites and what is expected of the students for their application. We have the careers unit that are more than happy to help all of our students. That's their primary responsibility. So any student here at Western Sydney can engage with the careers unit. I know that some of the workshops are even they've got no places left, but that doesn't mean that they're not having any more. I know that they are running interview-specific workshops in weeks 4 onwards for spring, as we're doing weeks 2 and 3. So there'll be plenty of opportunity for you all to engage with a workshop. And also I'll keep updating Job Readiness. As I said, it's a self-directed site. So the more you engage with the site, the better it is for you. I'm the only person that moderates that site, so I try to update it every couple of days. So if you think that I'm missing something, please let me know, and I will add it to the site. But the visa information I will definitely be doing the next 24 hours. So for that person who put on the question, I will definitely put some information on the visa situation soon.
Yeah. And this webinar recording will go on the Job Readiness site. Is that right, Nikki?
Correct. It will. I will put it on. I'll put it in there as a webinar, as a different content area, so everyone knows that it's there.
Thanks, Nikki. So I think we've just about covered everything.
Can I just ask, can I have a show of hands who has found this helpful today? Excellent. Okay.
They're still raising their hands, Nikki.
That's wonderful. Good.
How many of you love the bold and beautiful role play? More hands going up, Nikki.
All right. If I haven't answered the questions in this webinar, and you would like me to answer, I will just send me a quick email. I'm more than happy to. Only the beautiful, not the bold. I'm more than happy to answer emails. So yeah, no problem at all. Thank you, Suzanne, for running it. You've done a wonderful job.
Pleasure. You too, Nikki. Good luck with your applications, everyone. Hope you do really well.
Good.
Bye-bye. Almost finished.